As I mentioned, we have 8 patients for you to work with today, and we have several different types of patients. We have what's called a static mannequin. These are mannequins that do not have any sounds or vital signs available. These mannequins we will have stickers in various places on, so if you want to get a blood pressure, you look at the antecubital region on one of the arms and your answer will be there. Temperatures on the forehead, pedal pulses on the feet. You need to go through the motions of looking in the appropriate places for these, but all those signs should be there. Don't be surprised if they change at some point during that scenario, so be aware of that. The second type of mannequin that we have is called medium fidelity, and you're all familiar with working with these. These are the mannequins that have heart, lung, and bowel sounds, as well as blood pressure and a palpable pulse. There are some vital signs or other signs that we can't duplicate mechanically on these, and so again, there'll be stickers in the appropriate places for these. I also have to reiterate, things can change during the scenario, so be aware of that. Our final type of patient is the live patient. These are volunteers or faculty members who are come in, and they are your patient. If there is any invasive procedure involved, you will be provided a method of doing that. So if it's an injection, there'll be an injection pad. If there's an IV arm or an IV insertion, you'll have an IV arm, etc. You will use their existing vital signs unless for some reason we've indicated otherwise. Just remember, your interactions with all of these types of patients is to be real as possible. Talk to the patient. Be aware that the mannequins that aren't live and can't speak for themselves will have a person sitting next to them who is their voice. Pretend that person isn't there. Don't look to that person for help. Don't talk to that person. Your patient is the person in the bed, the mannequin in the bed, and treat them as your patient.